So in order to determine whether we will need an angle, in order to determine whether we need an angle for the knee, we will locate the ASIS, which is the most anterior projection on the pelvic, in the pelvic area. And this is our measuring device. We're going to slide it right up under our buttocks. And we're going to feel for the ASIS, which is right here. And then you're going to read where this line comes across. And let's see, I'll raise it up so that you can see. She reads at 18 centimeters, okay? 18 centimeters. So we're going to remember that. So if it's 18 centimeters, what degree of angulation are we going to place on our central ray? Caudat tube angle of 3 to 5 degrees. Caudat. So our patient measures 18 centimeters. So we have a 3 to 5 degree Caudat tube angle on our central ray. So I'm going to line up bucket trip. Patient over into the center of the table. And place her projection device. And move down toward her knee. Now notice, I'm at the end of my table. So what I will need to do is to slide the patient up on the table. So I'm going to slide her even further up on the tabletop so that I can So I'm going to center a 1/2 inch distal to the apex of the patella. I'm going to bring her down so she's come up tall. I'm going to feel for her patella, which is here. Feel the very base of it. And it's going to be in a soft depression. Okay? So we're going to collimate from side to side. I'll place my marker lateral to the cord. I'm going to rotate her leg in. About 5 degrees immediately. Now what we're going to have her do is rotate toward the lateral side of the affected side. And let's roll all the way up onto your hip. And we did state that we would have to flex the knee. Okay? Now it's very important to feel for the patella. Here's her patella here. Now does the patella look like it's perpendicular to the image receptor or the tabletop?
Yes.
It does. Does it?
Parallel, right?
A little.
Perpendicular.
No,
It is.
Okay, so what we want it perpendicular. So you can put the surface of your hand here. Rotate your knee down toward the table. So now it's perpendicular to the image receptor. I will move her back slightly toward the center of the table. I have a perpendicular central ray on this projection. 40 inches ID. And put my marker right distal to the patella here. And my central ray is going to be about a 1/2 inch distal to the medial epicondyle. Okay? And we can feel the medial epicondyle here. It's the rounded projection here. Here's the apex of the patella. So your joint space is right there. So that's where we will be centering. Make sure you are aligned to your bucky tray. Center. Half inch distal to the medial epicondyle. Now what I'm going to do also, here's the posterior portion of her knee joint. Here's the anterior surface. Make sure this line comes down her femur, so it's aligned with her femur. You're on the condyle, so just now put your angle on 5 to 7 degrees. And it's very slight. Go 7. Notice the difference in where my central ray is now. Whenever you put the angle on, put your angle on and look back at it. Because notice the big change once you put an angle on the central ray. Make sure you set it. Feel for the patella. Make sure she's still rotated down toward the table, which is where you want it. Notice that when you rotate her leg down toward the table and her patella is perpendicular, sometimes the patient's heel will come up off the table. Okay? Rotate your heel down. Relax your leg. Many times when they relax her leg, the patella is not perpendicular and her heel's down against the table. We'll have to roll into the table and bring that heel up to get the leg in a true perpendicular and lateral position. So always feel for the patella and ask the patient to hold still. If they can't, you can put a positioning device under their heel. Make sure that line is still straight. I'm going to ask the patient to hold still, don't move. We have a 40-inch SID. We have a 7 degrees cephalad tube angle. And we're centered a half-inch distal to the medial epicondyle. 10 by 12, portrait fashion. Hip light.
Inferior supply.
We're doing an inferior superior projection, which is a tangential projection called a sunrise projection. We're going to use a 10 by 12. We're going to place it in a portrait fashion. We're only going to do one knee at a time here, okay? So, basically, you want a 40 to 45 degree angulation of the part. So, we want the leg flexed 40 to 45 degrees. We're going to have our patient, either the patient can set like this on the table,